Hello everyone. Today we are going to address a very important question which is very common and it is not been fully addressed. This is called heart disease. Once you have a heart disease, there is a lot of dilemma because everyone seems to be pursuing heart disease as a blockage in the blood vessel which is carrying blood to the heart muscle, which is coronary artery. So everyone knows there is a blockage in this blood vessel and immediately it leads to panic, and then some of the procedure which is used as a treatment for this blockage is bypass surgery or angioplasty. Now all this panic is because of the concept that you have a heart disease, then this blockage has to be removed or immediately has to be dealt with. Now this is a perception which leads to thousands and thousands of patients going for this procedure called bypass and angioplasty unnecessarily. Now if you change the perception of the heart disease and how do you pursue this, then the entire scenario will change. Treatment for heart disease, it's never been a question of removing your block. It is about improving the blood flow. So what will happen if you have a blockage in the coronary vessel? Your life is not doomed. The reason is the nature already has provided you a plan B mechanism how to improve the blood flow even if you have a blockage in the coronary artery disease, coronary artery vessels. The reason is the blockage which happens your blood vessel is because of your aging. So if you think having block is a disease, then everybody over 60 years will be considered as having a heart disease. This is not a sin. So as I said, if everyone over 60 years would have a blocked vessel, then the entire community is considered as a heart disease. It is not so, because some people even with this blockage they were able to walk normally without any trouble or without any chest pain, or their exercise tolerance is excellent. In 60 years they may be able to walk around 1 hour or about 5 kilometers, then only they may experience mild discomfort in the chest. But there is another group of patients, even 5 minutes walking is not possible. Now how could two people with the same age, with the same disease, one was able to perform higher exercise tolerance, the other one is not able to do any exercise because of the discomfort or the cardiac symptom? The answer lies within you. It is called natural bypass. So nature has given an extensive mechanism or backup plan for this type of blockage which happens in your body. So when your main vessels are blocked, immediately the natural will provide a extra small vessels or micro vessels or a new vessel. This is called collaterals. Once this collateral opens up, it can able to carry the blood across the blocked artery effortlessly. So the patient would not perceive any symptom because actually there is no reduction in blood flow, even though the blockage is around 50% or 60% or 80%. So this could be achieved if a patient is active. That is why we keep on saying heart disease is a lifestyle disease. So if you change your lifestyle, naturally you recover from the heart disease. Surgical option, bypass surgery and angioplasty are only reserved for extreme cases, not for simple symptoms. So let's come to the other group of patients as I discussed before. These patients also have a blocked artery, but they were not able to do adequate exercise even for 5 to 10 minutes and they have cardiac symptom. The reason is they are not utilizing the natural mechanism of improving the blood flow, which is a collateral or natural bypass surgery. This group of patients would either be a sedentary lifestyle, they don't do exercise, or they have cardiac risk factor like diabetes, hypertension, high cholesterol level, or highly in stressful life. So when these factors are all present, what happens is this collateralization process or the new vessel formation or the natural bypass takes longer time to achieve. So when they take a longer time to achieve, already the worst thing of heart disease are already happening to them, the reduction in exercise tolerance. In this condition, if you change your lifestyle and adapt any mechanism to improve the blood flow, then these patients will immensely benefit and they don't have to go for this bypass and angioplasty. This is where natural bypass treatment called EECP plays a very significant role. EECP, what it does is it reverses the blood flow from your leg towards your heart as if you are doing an aggressive exercise. So it increases the blood flow consistently every day for 35 days. The treatment is 1 hour per day for 35 days. So during this 35 days, what will happen is the reverse blood flow which reaches your heart stimulate the natural collateral which is having difficulty to form because of your risk factor and sedentary lifestyles. Once these new vessels are formed because of EECP, the patient's symptom drastically goes down, and then these guys who was not able to walk for 10 to 15 minutes, they start walking for 45 minutes to 1 hour. Once they able to walk or they can improve their exercise tolerance, the requirement for bypass surgery and angioplasty is non-existent because your flow has been restored naturally. No hospitalization, no pain, no surgery, and highly cost effective.